Good evening, ladies and gentlemen. My name is Shekhar Shah. I'm at the National Council of Applied Economic Research, and I'd like to welcome you to NCAER's coronavirus briefings. We've been doing a series of these, and today I think we're going to have one of the most interesting ones because it captures a dilemma that certainly India and many other countries face as they have proceeded with a very serious series of lockdowns that have stopped economic activity and the virus. And the pressures are building up for easing those constraints. And in doing that, we are confronted with a number of different questions. And I'll focus those questions just on India. And then I want to talk a little bit about how we hope to address some of those questions using the experiences of some other countries and serious research work being done on these issues. The questions that are topmost in our minds are all relating to the most important approach that every country literally has adopted to combat the coronavirus, and this is social distancing. And the key question that we want to address and learn from others is, are the returns to social distancing the same in India as they might be and are in other higher income countries? And so that leads to the next question, is the dilemma of balancing lives and livelihoods, which is a very serious dilemma for India certainly, is that dilemma pan out the same way in other, again, richer nations? And depending on the answers to those two crucial questions is the theme for this particular webinar, which is, should India be chalking out a much more distinctive strategy and an urgent roadmap for recovery that's really grounded in its own social, physical, geographical, and economic realities, and whatever we are learning about the way the virus is proceeding and COVID-19 is proceeding in India. To answer these questions, I have a distinguished panel with me, and I'll introduce them. Dr. Shitij Kapur is Dean of the Faculty of Medicine, Dentistry and Health Sciences and Assistant Vice Chancellor at the University of Melbourne. More importantly for us, he has led a recent university-based expert task force that has produced a report that he will talk about, Roadmap to Recovery, done in 3 weeks by 100 scientists, all university-based, providing options to Australia for what it should do in the context of its own success, and this is now widely accepted, its own success at limiting the coronavirus. Professor Kapur was trained originally in India at the All India Institute of Medical Sciences. He's been a dean and the head of school at the Institute of Psychiatry, Physiology and Neuroscience at King's College London. I said physiology, it should be psychology. And of course, professor of psychiatry at the University of Toronto. Prior to this, he was also the vice president for the Centre of Addiction and Mental Health in Toronto. He's led a number of international consortia, including in the EU, NewMeds, one of the largest academic industry research collaborations, to find new methods for the development of drugs for schizophrenia and depression. Next on our panel is Professor Peter Robertson, also a key member of the group that put together the Roadmap to Recovery. He's Professor of Economics and Dean of the Business School at the University of Western Australia in Perth. He has earlier worked at Australia's Productivity Commission and at the University of New South Wales. He continues to consult with the Productivity Commission and the Australian Department of Innovation, Industry, Science and Research. And he's a member of the Australian Research Council's College of Experts. My third panelist is Mushfiq Mobarak, Professor of Economics at Yale, both in the Economics Department and in the Yale School of Management. Mushfiq is the founder and faculty director of the Yale Research Initiative on Innovation and Scale. He's a member of JPAL, the Jameel Poverty Action Lab at MIT, and the IGC, the International Growth Centre at the London School of Economics. He has worked on a number of different areas, but the one that is of most interest to us today is the work he has co-authored, trying to measure the payoff or the premium or the return to social distancing in different settings, including in low and middle income countries. And finally, my fourth panelist is Neelkant Mishra, Managing Director and India Equity Strategist for Credit Suisse, widely rated as among the best analysts in India by one and all, and certainly by the journal Institutional Investor. He's been an advisor to many government committees, including the Revenue Neutral Rate Committee on GST and the Fiscal Responsibility and Budget Management Review Committee. Neelkanth is a computer scientist by training, used to work for many years as a software, as a senior technical architect with one of our largest tech companies, but now has proven himself also as knowing the pulse of the market. So I have a wonderful panel, and we're looking forward very much. What we are hoping to do is hear from Shitij and also from Shitij and from Peter first about the roadmap to recovery in the context of their own thinking about what Australia might do. Thereafter, I'm going to turn to Mushfiq for his explanation of what they found when they tried to measure the payoff from social distancing, and then coming at the end of the initial round of remarks, Neelkanth, who will pose the challenges that we still face in India. With that, let me turn to Shitij, and before doing that, invite all of you attendees to please use the Q&A box in case you have questions. We will try to come to them at the end, and we look forward very much to this interaction. So, Dr. Shitij Kapur.
Thank you very much, Shekhar, for that very generous introduction. And look, it's a privilege to be a part of this group, and it's a particular honor that you would think that what we've done here in Australia, might have anything of value to you. So, with humility that what we've done only, of course, applies to one country, I thought I'd share with you. But perhaps it's helpful if I shared with you how we got to the roadmap. So it all actually started. So the first Australian case was on January the 26th, which is a day that's very important to Indians, but it also happens to be Australia Day. And actually, it was in Melbourne, it was in my faculty of medicine that we had isolated for the very first time outside of China this virus. And at that point in time, no one really knew what this was all about. So that was January. And then all through February, not much happened in Australia. We had, 2 cases a day, 4 cases a day. It was about mid-March that our cases started going up. And that's when the government started getting really concerned as to what this might mean. And so around mid-March, we got a call from Professor Brendan Murphy, who's the Chief Medical Officer of Australia. He happens to also be a professor at our university. And he said, everyone's talking about this social distancing and we should implement that. And this is, I'm just reminding you that just about 60 days ago or 75 days ago, social distancing wasn't even a thing that general experts knew about. So he said, can you put together an expert panel who can tell us about social distancing? What's the efficacy? What's the consequences? So we very quickly went around. We looked around Australia. We got about a dozen experts. We conferred for about 4 days, really, I think. And we were able to put together all that was known on social distancing and published. But as we submitted that report to the CMO, what came home to all of us is while there was some things still written about social distancing, largely in the context of flu, there was very little written about an exit from a vast countrywide social distancing strategy. Frankly, it had never been done. So we decided that, while the government is worrying about social distancing and controlling this, probably a good thing we might do is how do you come out of it? So in early April, in the first week of April, we decided to convene across 8 of Australia's leading universities, medical scientists, epidemiologists, economists, but also ethicists, philosophers, social scientists, and the whole lot, the whole gamut of what a university has to offer, because we were pretty convinced that in the end, this will be a whole of society challenge. it won't even just be about, infectious disease and economy. This will probably change things as we know them. And perhaps we were right in that regard. So we started on that in the first week of April. And in the second week of April, Australia got totally locked down. And the Prime Minister announced that we are not coming out of this lockdown till the 11th of May. So we then decided that, what we should do is try to say what should be done on the 11th of May, because there's no point in second guessing what is to be done till the 11th of May. That was settled by the Prime Minister. So that's when we went and created our roadmap. It is, as you said, the work of over 100 real experts. My job really has been much more as a convener and bringing together these brilliant people, Peter being one of them, and you'll hear his expertise. So let me just show you what we got out of all of this. So out of about 3 weeks of deliberations came these 3 reports. We went in trying to produce one report, but as often happens when you get 100 professors together, we didn't have one, but we had 3 reports. There's a complete report of 192 pages, but an executive summary, which itself ran into 28, so it's hardly a summary. But anyway, this is what it looks like. And our main findings, which were, by the way, submitted somewhere in the 3rd week of April to government, were these. We felt that Australia had 2 viable options. And what was interesting was that when we had started this proposal, the idea of eliminating the illness just seemed impossible because we were having 500 cases a day. But by the time we finished, elimination was a viable proposition. And we said that if you fail in elimination, there'd be a very viable ability to suppress the illness to a very low level so that you can manage it. And we, of course, discarded the idea of herd immunity. And by this point in time, it seems almost every country, even perhaps including Sweden, is pedaling back from the idea of herd immunity. And then, look, we gave a lot of detail. Now, what's interesting is we submitted it in the last or 3rd week of April. We are now almost a month from that point of view. Listeners might be wondering which strategy did Australia choose? Was it 1 or 2? And I would say the answer is 1.5. So that is because of our states, about 4 or 5 of them have actually eliminated the illness. And they've now actually put up borders from the other states who are more at the suppress the illness level. So yesterday in Australia, there were, I think, 3 cases across the entire country, and of course, none in those 5 states. And Peter is in one of those states, and he can tell you what they think about the rest of Australia from that state. But I think in addition to the options, the most critical thing was for us to highlight 3 requirements. The one we said was a very vast system of early detection and supported isolation. The second was travel and border restrictions, and we provided details on all of this. But the third, which I think in the long run will probably turn out to be more important than anything else, is public trust, transparency of how decisions are made and on what data they're being made, and civic engagement. This is not the kind of thing that any government can impose. Just the vastness of it makes it impossible that any government can sort of force it upon a nation. Unless, the rank and file buy the idea, and unless it's reasonable to them, they've got to balance many things, it just won't work. And then we said that there were 6 imperatives. The most important about them being the health of our healthcare system. And I think there's an important thing to point out that, Australia has something like 400,000 deaths a year. So in the 3 months of COVID, we've had about 120,000 deaths. Only 100 of them are through COVID. So, people died for a lot of reasons. And we were very worried that if the entire healthcare system just got requisitioned with a myopic focus on COVID, and by the way, it has sadly happened, we will lose way many lives from other illnesses than we will. And I think that's probably true for Australia, though there's no evidence. This is just my view. The other was that we felt, and this was mid-April, that, it wasn't that you just relaxed the rules and people just show up for what they were doing. And that you actually had to prepare, and particularly we felt that schools would be important flashpoints, that you have to actually prepare society for return. And that is still a work that's going on. And schools are very important because, children are precious in every society. And even though theoretically the danger might be low, practically getting people to feel that is very hard. And evidence from Ebola and SARS and the lockdowns that happened in that context actually tell you that this is a very hard part, and schools are a very important flashpoint. We realize that mental health will be a huge challenge. Anywhere between 20 to 25% suffer anxiety, depression, or post-traumatic stress disorder in the 6 to 9 months. And this is across cultures. And we wanted the country to prepare for it. Indigenous Australians are a particular concern in Australia. We have a rather shabby history of what we've done to and with our Indigenous Australians over more than 2 centuries now. But what we were particularly worried in this context is that many of them are in regional and remote areas and are in very closely knit communities. When we wrote, the infection had not as yet reached any of those communities. But what we were very worried is that, and they don't have any natural borders to protect them in some ways, but we were very worried that if it crossed that boundary, it could really be a great tragedy. And then, of course, equity of access and outcomes was very important. Even though we have a public healthcare system, and even though it's free at the point of care, access is still not the same. And we were very concerned about it. And the last was the clarity of communication. And this has to do with civic engagement, that unless we have the clarity of communication, we will not have the civic engagement that was needed. So, well, how did it work out? Well, fortunately, Australia has been doing well. So this is our graph of the day. So when we started our report, we were somewhere at the peak. When we finished the report, we were somewhere here. Australia was having between 100 and 200 cases a day. And the lockdown had anyway to continue to May 11th, which is somewhere here. But as you can see, we have rather few cases. And as it says, today there were only 2 new cases. And as I said, that's also only in a part of Australia. So I think amongst the Western nations, Australia has done well, and you might wonder why. Well, I don't think our report was the reason for it. Our report might have been one of the correlated factors. I think the big reasons are we have a unique geography. We're in a part of the world where you can shut off the rest of the world. We're not a throughput point like London and other cities are for people wanting to get somewhere. And then look, we're a small country of 25 million people in a vast continent. So density is low, and that helps with spread. And if you look at our biggest spread, it's still in our 2 biggest cities, which is Melbourne and Sydney. But that helped. And then, of course, look, we have a well-resourced healthcare system with good public health. And I think that's important. I would say that even the US has a very well-resourced healthcare system, but perhaps not as good a public health infrastructure as we do. And then what is surprising has been the remarkable cooperation between politicians and experts. For the last 2 months, every time the Prime Minister steps out to give any speech, he gives a little introduction, hands it over to one of our chief medical officers or deputy CMOs, steps back, and then walks in and closes that. So, and as you would know, if you look around the world, that has not been the case, in all countries. The next thing that I would say is the surprising trust between community and politicians. Now, you might think that Australians of their own nature trust their politicians. I can tell you, having lived in many countries, the general derision of politicians, even as recent as this January when the bushfires were happening. So it's not that politicians generally have a very high level of regard, but we've now done some surveys looking at people's willingness to follow the advice that's provided by politics. And we find that close to 80–90% of the Australians are willing to listen. And in that regard, this was a cross-country survey. We were much closer to Taiwan, which has similar numbers, than we were to the US, where that similar question is somewhere around 40 to 50%. And the last thing, not to be scoffed at, is government's thrown a lot of money at this. 60% of Australia's workforce, in a direct or indirect way, completely or partially, is being supported by government at the moment. So look, that's our story here. Some of this was anticipated in our report. Perhaps in some way our report also informs some of these things. But look, it's a very small part in a very large system. Now, of course, we've been wondering, I have been personally wondering, that, what we've learned here, does it really have lessons for any other jurisdiction? And of course, India is dear to my heart. I think about that all the time. And I think the first lesson is that if you're trying to take the Australian lesson and apply it to India, it'll look like this. Now that is a kangaroo trying to be an elephant. That's not going to be helpful. But I still hope that there is perhaps something in the way that we've done it, or some differences that I think might be helpful. So let me quickly end by just sharing with you, my own humble opinion, some of those differences which perhaps are relevant when I think of India's challenge and its opportunity. So the first thing I would point out is that there are likely many more cases than are currently apparent, and I'll show you the evidence for that. And what I want to point out is everywhere around the world, but certainly in India, there are even more who are likely infected. And that changes the equation of how we think about it. And the last thing is that India's youth is its greatest asset. And I think Mushfiq will speak to this perhaps at greater length, but I'll just show you some evidence to that effect. So very quickly, more cases than likely report. And this isn't my view. This is the latest data from the London School of Hygiene and Tropical Medicine, and this is probably one of the best epidemiological groups in the world at the moment looking at this. And they have this statistical method, and so it's a projection in many ways, to look at the data of a particular country and then estimate from that how many of your true cases are you picking up. And their estimate 3 days ago when India was about 100,000 is that you're picking up 37% of the cases. So according to them, the likely number of cases is probably 3 times as high. Now, mind you, in Indonesia, that number is 14%. So their prediction would be that Indonesia, there's probably 6 times more cases. Iceland, which is probably one of the best jurisdictions, every single person has their genome mapped. There they think that the coverage comes close to 100%. So this should give us some cause for pause, because one can get too preoccupied by the daily statistics and think that that's a very hard number. So that's the daily cases in India, and as you can see, it's going up. But I'll tell you what worries me more than this numbers, because you can look at these numbers and say, well, they're at 6,000, maybe at 6,000 it'll peak, and then it'll start coming down, and that could well happen. But here is what I am worried about. So I looked at the test positivity rate, and this is data that's available from the COVID India 19 website, but rather than taking their cumulative number, I looked at the test positivity for the last 3 weeks, and this is what you see. So it is going up. So, and that is not what it looks like before you are peaking. In fact, the curve almost has to be opposite. You have to test more, get fewer positive numbers, and that is how you're reaching the peak. And if you go back and look at the peaks of people who've had peaks, in other words, they now have a decline, this profile is not consistent with the peak. So look, I'd love to be wrong, but it seems to me unlikely that we're close to the peak. But the other point to see is that the number of infections, which is probably what matters epidemiologically more than cases, because infections is a biological reality. It means the virus is in you and it's replicating. A case is a clinical definition. It differs across jurisdictions. It differs across times within a jurisdiction. China changed its definition of cases 7 times over a period of 3 months. And nothing illegitimate about it, but all I'm saying is that. So how does it look like? So this is the data, and you can get it from antibody testing, and it has been systematically done now, probably in 3 or 4 jurisdictions. And that's what it looks like. That in almost every jurisdiction, it's probably a multiple. Somewhere close to 5 to 10 times more people get infected than are cases. Now, this is a good news and a bad news. The bad news is that it makes getting a complete clampdown control on infections and cases very difficult, because there are many more infections going on than appear even as cases. And then, of course, you're not capturing all your cases. But the good part is that the fatality rate of the disease went down by a factor of 10. Not the case, but the infection fatality rate. In the end, that's probably what matters at a population level. So the disease, now mind you, I'm not suggesting it's like flu. Please don't get me wrong on that, but it is probably less fatal than it appears. And I think the last point I'll say is India's youth is a huge competitive advantage in this context. Competitive is probably not the best word, it's the only one I could think of. And that's what India looks like. 75% of India is younger than 45, unless you think that's how every country looks. No, 50% of Italy is older than 45. Now, that has many implications, but I just want to focus on one, and that's the following. That if you actually look at the mortality rates by age, there is very good reason to believe that even in India, though the Indian data, I could not actually see the government's official data, perhaps some on this panel might know it. But if you look at all the countries that are documented at the moment, you can see that pretty much to 0 to 49, there is very low mortality. And most of it is 50 plus. I can give you the case of Australia. We've got 102 deaths. 50% of the infections are in people 45 and under. There is one death in a person 45 and under. All our deaths is in the other 50%. So it's huge. And therefore, that democratic shift really matters. Now, how to convert it into a strategy is a complex matter. But look, with encouragement from my friends, Max Serene at Sandeep Goyal, with whom I went to school, and Professor Amitabh Mattu, who's here at the Australia-India Institute, I dared to sort of write an editorial to put that together. Now, it was more of a provocation. It is simplistic. It is not an answer. But I think my hope in that was to really open the debate. And Shekhar, thank you very much for that.
Thank you, Shitij. And I'm just going to send out the link to Shitij's op-ed that came out in the Indian Express on the 15th of May. And indeed, our title of this webinar, Recover and Shield, comes also from that op-ed that he did. Without much ado, let me turn right away to Peter and to fill us in more on the economic calculus that was used to think about the two strategies that you eventually came up with in Australia. Peter? Peter, you're muted.
Someone's got to find a technical solution to that. You know,
it's happened a few times, isn't it? Thank you, Mum. Yeah. I'm okay now, I hope. So it's just saying thank you very much. It's a great pleasure to be here. As Shitij said, we've got our own little economy here in Australia, and I'm not an expert on India, so but I think that maybe one of the purposes is to sort of compare the differences between the Western economies' approaches to this and what might be appropriate for India. So let me just talk a little bit about the way I've been thinking about this, and some of the people I was working with were thinking about the challenges we faced. It's fair to say, I think even now, at the time we were doing the report, and even now, there was a huge difference in views amongst economists. So that's aside from the 100 academics that we had from all the different disciplines. And I think Shitij brought off two miracles. Once he brought 100 academics together to talk to each other from different disciplines, and he managed to get the politicians to listen as well. So 2 miracles before breakfast. It was really well done. But there is still, I think, quite a big difference in views, with people taking opposite ends of the spectrum about what the value of a life should be implicitly when you're doing these sort of calculations. It's an unsavory thing, and people feel very squeamish about talking about that. But at the end of the day, in any public health type of situation, you're going to either implicitly or explicitly place some sort of value on the lives that you expect to protect with that measure. And that's true for a whole range of situations, from vehicle safety considerations, building regulations, through to putting a stop sign in the street. So in Australia, there is this, we use a concept of a statistical value of a life, or a life year, and the value is around 5 million Australian dollars. That's about $4 million US dollars. But you'll see values around the world, different values reported, sometimes double that, sometimes a little bit less. One of the more controversial things then you're thinking about is, well, what about the demographic profile of the fatalities? And generally it's skewed towards older people who might be in the last quarter or even 10th of their lives. So if you then take that sort of Australian number, multiply it by the expected fatalities that you might expect in a sort of unmitigated, uncontrolled sort of situation, and then take about 1/3 of that to factor in the fact that you've got mostly older people being affected who are at the end of their lives. then you might get a value that the cost of those fatalities in a public health sort of sense would be around about 8 to 10% of Australia's GDP. Now, we got told by the Treasurer a few weeks back that it's costing us now 4 billion a week in terms of unemployment insurance and various other costs. That's the cost of the lockdown. And so if you take that number as a ballpark, then that adds up to a little bit less than 1% of GDP per month. And so you've sort of got this sort of, well, if the virus went through and killed everybody that it would do anyway, then that is a big cost, and the cost of the lockdown is a much smaller cost, but it's going to accumulate over time because it's every month you're losing that much in terms of, it's costing that much in terms of unemployment insurance and so forth, unemployment benefits. And so that's the kind of calculus. So the first thing that I was happy to see is, well, the government's sort of got it right. It makes sense to lock down. The costs are large on society, but the costs of not doing that are much larger initially. And what, of course, that's done is buy us time. And I think it is in a similar situation now. It did get borders locked down fairly quickly, which is probably the main thing to do. And of course, then you've left in a situation, although the virus is still spreading in both our countries, potentially, the case fatality rate is very low. The case rate is very low. And so you've sort of got time to work out a few solutions, and you've got time to try and find some medical solutions in particular. So Australia is now in the sort of section, well, what do we do next? And I think politicians did such a good job of scaring everybody into lockdown that, as Shitij says, well, the big question is, how do you get people to come back out of that? And the Prime Minister in Australia used a very nice colloquial phrase about basically coming in from under the blanket. We call it a duvet. So how do we get people to come out from the peak, take a peek out from under the duvet or under the doona, and come back to sort of the world where there may be COVID round and there will be people getting infected, and workplaces are going to change, but in sense, you would need to get back to work. We need to carry on. We can't afford a 5-year holiday just waiting for a cure to turn up. So, and it's kind of interesting because the aim always, I think, Shitij, was just to flatten the curve. It wasn't to eliminate the virus. And so here we are, we've almost eliminated the virus in Australia, but politicians are struggling to get that message out. There's quite a lot of interesting discussion going around the different states about the staging of the relaxation now of the restrictions. As was mentioned, I'm in West Australia, which hasn't had any new cases for a week or so. South Australia and Queensland are in a similar situation. And our Premier wants to keep the borders locked to at least September, just in case anyone from New South Wales comes over here and brings a nasty virus with them. So West Australia is a mining state. It exports iron ore to China. That's mostly what it does. And we can continue doing that. But there is a tourism sector. And for Australia as a whole, the tourism sector is a really big issue. It's going to be very, very important. And if we stay in this kind of lockdown mentality, then it'll be very, very hard to see much international tourism coming back. It'll be okay for New Zealand because there'll be lots of Australians can fly to New Zealand, but New Zealanders coming here doesn't give us such a big boost. So that's one issue for the future. So that was the kind of calculus of the situation. You know, really the economics makes sense as a short term. The costs are manageable in the short term, but they will build. And that 1% of GDP that I was mentioning doesn't include any sort of social cost. It doesn't include any additional costs through recessionary forces that might build through lack of confidence and so forth. And it's possible, even if you take the restrictions down, people just won't go out to the shops and buy things anyway. So there's a lot of unknown costs around that as well. So my sense is that you really don't want to remain in this kind of lockdown situation. It'd be much better to get back to a sense of normality and learn to cope and live with the virus with better standards of hygiene and different standards of social distancing. In particular, you know, there's a sense we could have this double tragedy if we stay locked down too long and the virus doesn't turn up, then eventually in 18 months, then eventually we will have to go back to that sort of adaptation strategy anyway. And so all those gains, all those costs will have been really for nothing. So that's the way I sort of see the Australian situation. I don't want to go on too long, but if there's any prompts anyone else wants to ask, I'm happy to bring it up. I'll just leave it there for the moment.
Thank you, Peter. And I think you pointed very correctly at just the tremendous variation in Australia in terms of how different states have responded to the lockdown and the national directives and guidance. And I hope we can come back to that, because that's an important concern for India as well, with its multiple states and union territories, and the shift away from central control and directives now much more to states being given the autonomy to do what they think is appropriate. And that's where Shitij's points about trust and transparency are going to kick in a big way, because I can just imagine trying to get from one state to another state. First of all, I'll have to get a kind of a e-ticket that the receiving state has to issue to me so that I have a pass. And then at the border, I'll be stopped and I'll probably be told, okay, so you can quarantine yourself for 14 days right in that hut, and then we'll come back and get you 14 days later. So you can imagine the kind of coordination cost that this is going to impose. We haven't had a lot of it as yet, but I'm sure it will. Let me turn to Mushfiq Mobarak from Yale. Mushfiq, tell us about the work that you've done already, which has been published. It's on the invitation, the reference, and then you said that you actually have been doing a lot more work in this area as well. Mushfiq?
Hi, thank you, Shekhar. So I want to start by congratulating Shekhar on putting together this really excellent panel. Like, one of the things I teach, I'm a development economist, and one of the things I teach my PhD students usually early in the semester is that you can't really learn about development if you just study the poor countries. You need to study both places where have challenges and places that have been successful in order to understand what drives development. And similarly over here, to understand what's going on, what I really like about this panel is that you do need to learn from the successes like Australia, right? But places that are continuing to face really strong challenges like India or Bangladesh. And a lot of what I talk about today the data will come from Bangladesh, Nepal, places that are similar to but not the same as India, and also data from like Sierra Leone and Nigeria. And so on the original point, I want to highlight and maybe reiterate some of the things that Shekhar said and add some data to it. Okay. So how did this work start? So unlike, say, Zika virus, Ebola virus, etc., one unfortunate thing about the trajectory of this virus is that it started in rich countries, right? So we heard a lot of stories early on of what's happening in the US and UK, and that tends to suck up all the oxygen in the room. Like, once something happens in the US, the international media's attention turns to that. And so we kept hearing stories every day about, oh, here's what you do. Or even in South Korea, here's a really sophisticated mobile-based contract tracing you can do, right? The thing is that it's not that useful for us to hear these stories in Bangladesh because we can't enact those same strategies, right? And we might not even want to think about social distancing or the basic macro strategy in the same way either, right? So to answer that question, should we be thinking, following the same strategies? So what we ended up doing was, there is this model that was very influential at the time, the Imperial College model. Right? So my idea was, okay, let's just put in some economics to it and add some developing country, lower income, middle income country numbers to it, and let's see if we get the same answer. Okay. And as Shitij already indicated, you're not going to get the same answer. Okay. And one reason is something that Shitij mentioned, which is that the demographics are very different. Okay, so this is the distribution of the percent of population who are elderly above 65, right? In low-income countries, it's about 3% of the population. In high-income countries, it's about 18% of the population, right? So that's a six-fold difference, and that's going to make a big difference because of what Shitij already said, which is fatality rates across different age groups are very, very different. So you're not going to get the same benefits. Right? And another thing I'll add to this is that, remember we were hearing a lot about flattening the curve, to keep it under the healthcare capacity line. Okay, so this might be a little bit hard to see in this in the graph, but so there's this dotted line. I should probably use different font for that. But what happens is in Bangladesh, right? If you social distance, right, the number of cases, and let's say this is 100% is where the capacity for each country is. This is Bangladesh, this is the United States. Okay? So I've just normalized their capacity to 100%. Right? So in Bangladesh, if you social distance, you get the excess cases from here down to here. Right? It still stays above capacity. In the US, you can actually get it under the hospital bed capacity. Okay, why does that matter? Because it says in Bangladesh, even if we are successful through social distancing to delay infections, right, that's not going to save lives. If you're talking about rural Bangladesh, there's no ventilator. There's not going to be a ventilator 3 months from now. It doesn't matter too much if people get sick today or 3 months from now, right? Whereas in the US, it might matter a lot. That's another difference that comes out of that same model. Okay, and so now what you end up observing is that the benefits are lower because of these two reasons, right? So you have to compare it to the costs. Okay, and here let's think about what those costs are. And this is data we've collected the same data from the 4 countries I talked about, but I'm just using the numbers from Nepal. Okay, so what we have here, the type of data we decided to collect early on from about 4 or 5 weeks ago, is that, look, I had all these samples because as a development economist, I run field projects in each of these countries. So I had access to all these samples of people I had been tracking anyway, right? And that's useful because then you have statistically representative samples, so you can say representative things, but also you have baseline data on people, so you can sort of compare what's happening right now to what their life was like a few months ago, right? So in Nepal, I had been tracking in Western Nepal, a group of sort of relatively poor people, agricultural workers mostly, right? And this is so this is like people reporting to me about how worried they are about food, and this is like food insecurity, including like missing meals and so forth, okay? So what happens is, as we all know, those familiar with India, that there's seasonality in agricultural crop cycles, right? There are pre-harvest lean seasons, like this period, when in Nepal, lots of people are not getting enough to eat. And then post-harvest, those numbers come down, right? In Bangladesh, in North Bengal, like this is a phenomenon called Monga. It's called hungry seasons in East Africa, right? So these are periods where people just don't have enough to eat. Okay, and this is the lockdown in Nepal. And right after lockdown, what happened is their food insecurity reached levels comparable to the lean season. Okay, and what's dangerous about this is actually post their wheat harvest, right? So the post-harvest period looks as bad now as the lean period, right? So it's already bad, right? But I shudder to think what happens when the double whammy of both the corona crisis as well as the lean season comes, right? So July, August, September, based on last year's numbers, we expect July, August, September to be a lot worse than March, April, May have been. Okay, and we do need to worry about things like this. So essentially when you go, so all of this food insecurity, and why is that happening? So remittances are down. I don't have that graph here. Then people's job opportunities are down. Like this is the seasonal variation in work opportunity. This is what happens post-lockdown. Okay? The huge, like 65% drop relative to even the worst period in the rest of the year, right? So all of this put together, when you ask people what they're worried about, it hasn't been health and safety and virus. It's really been about food security and income shocks. Yeah, worry about that a lot. And so you cannot, in developing countries, you cannot decouple these problems. It's as much an economic crisis as it is a public health crisis, right? And beyond that, in India, right, so there's some data that comes from India that I want to highlight here, that beyond the economic shocks, you also see this is actually from both Pakistan and India, so this is from Sindh and Punjab in India, that lockdowns have led to sharp drops in institutional births, meaning people are not going in to have their birth in a healthcare facility as opposed to doing it at home. And from much other research, we know that can be dangerous. There's been a drop in prenatal visits, right? There's been drops in vaccinations, people keeping up with their vaccinations. So like in COVID, we worry about the R naught being above 1, 2, or 3, right? The R naught in the medical literature for measles is between 12 and 18, right? So if there's a reemergence of that disease, that's going to be a much bigger problem in our hands. Right? So I'm giving you a lot of concerns here. So, but I don't want to state that that this means that it should be a free for all. Right? Now, we should be thinking about balancing costs and benefits, and think about sensible strategies and policies that are the right fit for the country at hand, depending on how extensive the virus spread has been already, right? And as well as these economic concerns and other kind of healthcare concerns. And even within India, you might get different answers, right? Kerala did a really fabulous job of controlling the virus early. And so what they should be doing in terms of the sequence of what opens up, et cetera, should be very different from other states in India that just hasn't had the same type of ability, right? And then just to highlight some of the, just to connect it to the many excellent comments Shitij made, right? Highlight some of the difference. So Shitij was talking about Australia being low density. We don't have that, in Bangladesh, where I've been working with the government, we don't have that luxury, right? He was talking about Australia not being a throughput, right? That not many people are going through, right? In Nepal, 22% of GDP comes from remittances from abroad. Right? There are many, many migrants. So how did the virus appear in Nepal? It was, Nepal-India border is open, so many migrants were coming back, right? In Bangladesh, not only is it that the migrants bring it back, now we've done analysis of the government where we can, in the absence of testing, we can predict exactly where the virus will be and where you'll get distressed health from on the basis of Civil Aviation Authority data, where I just look at all the disembarkation cars from December to March, right? And you can get addresses on where the migrants are returning to. And that's exactly where the virus is, okay? There's a lot of difference. And the other one, what I was really, it was a privilege to listen to both Peter and Shitij, but having Shitij, play this leadership role, I contrast that to the US. If he had somebody, who using data spoke with confidence, clear-headed, right? In the US, we might have had a different situation than the clowns we have speaking for us here, right? And so something that he was talking about, which is, trust in politicians, trust in leadership, right? And people coming together, those are also going to be extremely important. Okay? So now just to finish with something positive, okay, so what do we exactly do? Okay? So of course, things that are sensible, like, look, hand washing, right? Those are simple things that we need to promote, right? Mask wearing norms, even though the WHO has not yet provided that as part of their guidelines, it's imperative. Based on my reading of the medical literature, as well as, both sort of field studies and lab studies, right? I think masks are protective. They probably reduce transmission, even though we don't currently have a randomized control trial, right? And then these worries that masks might make people complacent, those worries are unfounded so far, right? We should have strong mask wearing norms. Those are a very cheap intervention. And so we're just starting a randomized control trial in order to study the effects of large-scale distribution of masks and enforcement of those norms to hopefully, change people's opinions on that. We should be thinking about frugal innovations. So some simple things. So Sierra Leone, one of the countries where I work, so they had great experience, built up from the unfortunate crisis they had in the past 5 years ago with the Ebola, right? And so in every single building in Freetown, right, there's something called a Veronica bucket associated with this Ghanaian woman named Miss Veronica who came up with this. It doesn't require running water. It's just bleach and water in a bucket with a basin and soap underneath, right? Every single building has it. You go in, you have to wash your hands. When you come out, you have to wash your hands. Since it doesn't require running water, they have it placed at police checkpoints all over the country, as you enter sort of the remote rural areas, right? That's something that doesn't cost much at all, right? We need to take advantage of these frugal innovations, learn from the experience of other countries that are similarly resource constrained, right? And then one final thing is, relief. Okay, so regardless of our views of the appropriate level of social distancing, it's absolutely imperative that we get economic relief in the hands of people, because if they are suffering, if they're going hungry, whether or not you impose some kind of social distancing, they can't listen. Right? They're not going to be able to abide by those guidelines. Okay? And so you need to get money in the hands of the poor very, very quickly. And here, India actually has a leg up relative to countries like where I'm working in Bangladesh, Nigeria, etc. Right? Because thanks to work by the Aadhaar system and impressive public-private partnerships we've had. I know Nanda Neelkanth has played a big role in this. Right? So you have an infrastructure in place to get money out quickly to people. Like in other countries, we don't have that. And what we're trying to desperately scramble right now to do is in Bangladesh, how do we set up a new social benefit transfer system that identifies a new poor, right? And in India, you might also have new categories of poor that get created on the basis of this coronavirus crisis, because it's a new type of crisis, right? And you need to figure out how to identify them, okay? So in this particular case, I won't belabor this right now, maybe later on I'll talk about it. We're having to use sort of margin survey data, like socioeconomic data with cell phone data to try and infer sort of, are the poor or the non-poor have subtle differences in the patterns of cell phone usage that then allows us to pick up who's poor. Because if you can do it on the basis of cell phone data, then you can reach 150 million people quickly. That's the only strategy that we could come up with. Okay. Let me stop there.
Thank you, Mushfiq. I think it was a masterly lesson on what research and data can do if it's deployed well. And compliments to you and your team. I think there's just so much to learn from what you're doing. And when I combine that with what Peter and Shitij have been saying, there really is no dearth of understanding, and it's growing, it's evolving. It certainly isn't absolute. But the role of data, then the analysis, and then the trust and transparency that, and I was thinking of Tony Fauci when you were talking about the guy with the knowledge who's not able to speak. And, that is a common problem that we are facing. But with
I wasn't going to name any names, but in the interest of a conversation, Shekhar, I should also say one of the things I've learned is that there's an immense reservoir of talent in my country, in Bangladesh. Right? People are now coming together. People who are working at the mobile phone companies, people who are social scientists, natural scientists, medical scientists, just like Shitij was talking about in Australia. Right? And we need to take advantage of people.
I hope we can come around to what can we learn from the Australian process of coming up with the road to recovery. We clearly, all countries need that road to recovery, however they go about, putting it together. But with that, let me turn to Neelkant Mishra, who really is one of our best commentators and thinkers. He's also very often an advisor to the government of India, so certainly knows a lot about what's happening within government, though he's very much outside it. Neelkant?
Thanks, and it's been an absolute privilege listening to Shitij, Peter, and then I think it was very illuminating. And I'll try not to repeat some of their findings. I mean, most of the things I absolutely agree with. In terms of the economic loss assessment that we do, I just want to add a bit that we need to also think about losses of future income. And what I mean to say by that is, if you have say 20 trillion rupees of loss, right? So consensus GDP growth forecasts have gone from about 10% growth to 0% growth in India. So that's about 20 trillion rupees of loss.
Neelkant, could you bring yourself a little closer to the microphone? At least I'm having a little difficulty.
Sure.
Much better.
Yeah, okay. So 2/3 of income, GDP actually goes to individuals. So that is personal income, income from so salaries and interest and dividend, etc. About 17-18% is taxed to GDP, so that's income for the government, and the rest is retained income for corporates. Right? So about 15%. Now, in a loss year, so if you have an allocation of losses, there is a 20 trillion rupee loss. The loss for the corporate and the government will be higher than their normal share because they can't stop the clock on interest, on rents, on salaries. Now, assume there is a 20% loss instead of 15. Well, the share of loss is 20% and it's not 15. That's a 4 trillion rupee loss for the corporate. Now, even if it does not result in defaults and additional costs for the banking system, what this means is that for future investments, there is a significant reduction in the growth potential. So usually this will be levered up, so the impact on GFCF, the gross fixed capital formation and stuff, is actually significantly higher. So while the curtailment of income, as we see as the economy is being shut down, is in a way a smaller problem, because the moment you switch the lights back on, the economy starts to function. But the concern is much bigger for me, that we are actually curtailing a lot of future income growth, and there are no easy solutions to stop it. One of the points that I would like to add to what Shitij and mentioned is also state capacity. the ability to enforce a lockdown is also equally important, because when we think about a lockdown in our models, it appears very neat, but what you actually find is that the actual economy is working very differently. So, for example, and this is something that I must say I had started to think about and I had anticipated in middle of March, that like construction, nearly 60% of construction in India is rural. A very large part of that is rural housing. And what we are now finding that in the midst of the most stringent of the lockdowns, rural construction was doing fine, right? So the cement demand was actually doing okay. In fact, that has been the first of the blocks as the economy started to get opened up, that what we are finding is that cement companies are now back to 70% of normal. And this is despite the biggest cities, so Delhi, Mumbai, Hyderabad, Chennai, they're all being Kolkata, they're all being shut down. And so in those areas, in the semi-urban and rural areas, the revival of economic activity, if you measure cement as a metric, is actually 85%. So, so that clearly shows that while there was, in theory, a bigger lockdown, in practice, in some areas, it wasn't so much. That may not have been as damaging at that time, but now let's look at the new scenario. So in Mumbai, as per newspaper reports, nearly 2,000 people, 2,000 policemen have contracted the virus.
Neelkant, if there's anything you can do to improve the gain on your microphone, that might be helpful. A lot of people are chatting.
Maybe I'll you see me as much bigger. Is this better? Is this any improvement at all?
Yes, it is much better. Thank you.
Fine.
Thank you so much.
See,
What you're saying is so important that I think we should not miss it at all.
No, it's okay. So, so in Mumbai, for example, the police has been depleted, dispirited. This is what is called the marriage function approach to administration. That you have, if there's something that has to be done for 1 week, I think let's all hands on deck approach works. If something has to be maintained for 4 months or 2 months, that doesn't work. And I think that has been the problem here. I think the police's ability to enforce a lockdown has been depleted. It had to be the Central Reserve Police Force being deployed before the lockdown in Mumbai could be enforced properly. And I think that has led to the problem that Mumbai is 30% of India's deaths. This is not unique. I mean, New York is a very large part of the US, there's Madrid. And so every financial center, for whatever reason, is very densely populated and therefore has been the worst managed. But I think when we are looking at the ability or the advisability of a lockdown, we must consider the ability to enforce the lockdown as well. And this also means medical capacity. So we are already, yesterday Mumbai had 1,750 cases. Given the current prevailing CFR, case fatality rate of 3.5%, thankfully it has come down from 6%. This means that in a few days we will be looking at 60 deaths. Just to give you the numbers, we are, in a normal year, the number of deaths per day is 100, right? So 3,000 deaths a month in Mumbai. We are now looking at 60 deaths just from COVID. Right? Now, these could be comorbidities which would have perhaps resulted in death anyway, but this number is still growing at 6% a day. And in 20 days' time, and so therefore, the fact that the medical infrastructure is really creaking. And one of the points I really noticed, and I think a very important one in Shitij's presentation, that we should not have other medical capabilities being taken over. I mean, the Dutch oil disease, as we call it in economics, that every medical infrastructure is taken up by the virus. And then, but this is the problem. Now, 80% of the beds in Mumbai are now to be allocated to COVID. And we are running out of, all kinds of anecdotes coming up. So I think this is, and therefore, we are now in the midst of very tough decisions about should we relax the lockdown given the economic costs, or are we willing to bear the increase in the number of deaths without medical infrastructure? And this is just, I think, as of now, a very serious problem in Mumbai. But if you include the issue of migrants, the the remittances question that Mushfiq mentioned for Nepal, I think is a very important one for India as well. But the within country migrants, the intra-country migrants, I think are now becoming a much bigger issue. So look at the case count in Bihar, and the fact that the people who are tested, the Shramik special, the worker special trains that have been run, 1 in 4 from Delhi is positive. 1 in 8 from Mumbai is positive. Now, that tells you a lot about the prevailing disease in Delhi and Mumbai, because they were not caught at the source, they were caught at the destination. But the fact that the illegal migration through trucks, on trucks, and where, you know, maybe highway police have sort of taken advantage of these people all through. Imagine the number of migrants that you're not aware of, right? And in my village, in East Champaran in North Bihar, I mean, on one day we had 27 cases, and 10 days back we had no cases, right? So not in the village, I mean, in that district, we had 27 cases in one day. So, and these are places where, as Mushfiq was saying, I mean, these are places, there's no ventilator, there's no ICU. And so if the disease spreads, and disease spreads without your knowing, see, if you're catching them on the Shramik specials, it is I think better. At least they should have been caught in Delhi or Mumbai, but they've been caught there. But at least you quarantine them and they're not infecting others. But the people who have come on their own, and you have, the state has no idea of. This is where I think the lack of state capacity is a problem. Just to put things in perspective, in the number of police people per 1,000 in India is a third of that in the rest of the world. Delhi at 5 per 1,000 is, I think, the best. Bihar is actually is at 1. So I think the ability to enforce a lockdown is also, I think, questionable. But there are other things that I think we can be doing. I think we are in a much better shape than it would have been without. I think the PDS works nicely. I think there are flaws. There are ration card issues. But one of the problems that has been exposed by this, like the Chinese hukou system, has been much criticized. That it creates 2 classes of citizens. That if you're working in a different city, you don't have the equal rights. Now we have discovered, and this is something that informally we were all aware of, that the same system prevails here. That the migrant worker in Mumbai cannot avail of simple PDS services. And I mean, every city, not just Mumbai. And the fact that is one ration, one nation, one ration card is something that I think has been triggered, and I think it's an important step forward. All of these things are actually possible to do. Now, when we come to the steps going forward, it has been very tempting to think of it on the first option in Shitij's presentation, that we eliminate the virus, right? Because that's what the Chinese were able to do to some extent. Taiwan has done it, South Korea, but I don't think we are in a position to go there. So as the state recognizes its own limitations and realizes that we will have to somehow bring the R to 1 and live with it, can't make it good. I mean, we can't get the detections down to 0, which basically means that the number of infections remains constant over a longer period, but the medical infrastructure is still not inundated. But if the state is not enforcing it, so what the government is now hoping for, and I think perhaps that's more pragmatic, is that if the state doesn't have capacity, let the society step in. So the state governments in the recipient states may not be testing all the migrant workers, but now they are hoping that the rural councils, the Gram Panchayats, are testing and enforcing isolation, that people are being asked to live in schools outside the villages so that they don't infect people in the village. It's not very effective, may not be very effective, but this is, I think, the best possible solution. Now, when you have the society and people are now they're realizing that they have to take care of themselves, the state's not going to do it, the relaxation of the lockdown then takes a lot longer. The 0 and 100 option, you are now in a lockdown and now you're not in a lockdown. And I am aware that, in China, and as Shitij was saying, even in Australia, how do you get the fear out of people that, look, it's okay to venture out and, do the normal things again. Imagine that for 6 months you have been taking care of yourself, and then you have to sort of open up. I think the process of opening up, therefore, will be much more prolonged. And that's an economic cost as we are planning for the future, something that we must be very, very careful about planning for, because it will not be a switch on, switch off kind of an improvement, because the people's mindsets have to be changed. I'll stop.
Thank you, Neelkant. I think that was an excellent listing of the many challenges and the dilemmas that we face. We are where we are, and I'd very much like to see from the panel a conversation between you. We have a few questions as well. We'll come to that in a short while. And if I could turn to Shitij, and Shitij, you started and you ended with this notion that we should recover and shield. Can you expand on that a little bit, and then let's see if we can think about practical ways in which both the state governments, the central government in India can do some of those things, and also for us in the research world, in the think tank world, in the data and evidence producing world, how can we help? I think this is going to be an important inflection point where evidence can significantly, and the experience of countries like yours can really influence many actions on our side, which can lead to good results. We are in a difficult space, and I think we need to make sure that at least we have a good roadmap, even if it's going to take long, that it's reasonable, that it's evidence-based, and that it actually will show us results which we can measure. Shitij? Shitij, you're muted.
All right. Perhaps at the end of this COVID, someone will figure out how Zoom knows that you're talking. Look, I think in the heart of all of this is how you set expectations right. And I'm with Mushfiq in this, that, because it started in the high resource countries, or you might not call China high resource, but the amount of resources and the amount of political will it brought to bear upon this issue is dramatically high. That has become the only mode of response, and the expectations have been set with that. I think so you see, at heart, if you believe that we've got 6,000 cases a day, if we just stay at it a little bit longer, we'll capture it at 7,000 and we can deal with 7,000. You think about it this way. Or if you think that in certain jurisdictions this will overflow, and all you can do is pragmatically manage the overflow, rather than the flattening the curve concept, which was that you will take the time to build your healthcare capacity and manage it. So I think it's a very hard, but at the heart of the dilemma, it is coming to terms with that and then building the political acceptance for that answer. So you see, all the countries have gone out sort of promising their people that this thing can be contained. That if you come along with us, you make the sacrifices in a finite amount of time, though no politician has specified exactly what that finite amount of time is, the idea is we can overcome this. And I'm beginning to worry whether that is truly possible, and whether accepting some pragmatic level of loss and managing everything else around it is different. And the example I would give is, during the time of war, politicians are able to mobilize their populations, bring in a sense of sort of national pride and get people to make great sacrifices of life and property in the name of a larger cause. Whereas in this context, what we told everyone, as our Prime Minister says, is go home, get under a blanket and hide. So we started off on that concept. And in some jurisdictions, it has sort of worked. For South Korea, that's worked. For Australia, it's worked. But for jurisdictions where it's not working, I think there has to be a change of a narrative. There has to be a reasonable expectation, and then pragmatic solutions. And to me, one of those pragmatic solutions has to be based around the concept that this disease is not that fatal for people under 45. And with 3 relatively simple and applicable things: wash your hands, wear a mask. And I can't understand why it has been so difficult for experts to concede that a mask might be helpful. There almost seems to be some sort of a very academic objection that until the RCT is done, we won't prescribe a mask. But to me, it's wash your hands.
It's also the CDC, which, for the longest time suppressed
Absolutely.
the notion just to be able to save those N95 respirators for health professionals. And it was a completely wrong approach to take, I think.
You're absolutely right. You see, in the epidemic situations, the reason why you don't want everyone rushing for masks is because you want your healthcare workers to have them. I think in every jurisdiction now, we've got enough masks for our healthcare workers, and everyone can use their t-shirt or their sari or something to craft a little mask. So my sense is hand washing, masks, and reasonable physical distancing, and avoiding large gatherings, unnecessary large gatherings. These four simple things that almost any jurisdiction should be able to do at scale may get the R down considerably. Now look, whether it gets it down below 1, I don't know. That depends jurisdiction to jurisdiction. So it's a different shift in mindset that's required.
One of the things that seems obvious from what you've said, Mushfiq and Neelkant and Peter have said, is the role of communication and how these messages are being crafted. And I know in the road to recovery, that was an important component. Mushfiq, any thoughts on how in our part of the world and your part of this world, what can be ways in which we can promote better communication of the kind that's needed to build the trust, to build the downscaling of expectations to more realistic ways, which in the end will be more beneficial, and to be able to make that persuasive argument that actually by becoming more normal in your activity with these precautions, the four that Shitij talked about, we actually will come out ahead.
No. So there are, two types of, there's two ways to interpret your question. There's communication coming from the center and from the leadership, right? And then there's also like direct communication with people in various remote rural areas and distributed across the country. So let me tell you a little bit about what I've learned about communication and what we're deploying now in Bangladesh. So here's something we learned from the Ebola crisis. So after, when Ebola hit in 2014, 2015 in Sierra Leone, the government turned to what they thought was the strongest institution in order to communicate with people and get the message out, right? And that's the military, right? So they had military vehicles going out, blasting messages about Ebola and its dangers, right? But what happened was, given the country's history with the military and civil war, right? People were running away from military vehicles and not listening to those messages. Okay, so that turned out to be just not the best idea, right? So having learned from that experience this time around, immediately they started communicating at the local level through local community leaders like Mammy Queens, who are important women leaders. They even had like these town criers with boom boxes going around, spreading the message. And then that kind of clear communication from trusted sources, right, locally, turned out to be, I think, quite important, right? So now, what we ended up doing in Bangladesh, like now at small scale, but hopefully it'll be scaled up, two things. So one is that when I was making all these, we're making thousands of phone calls around the country in order to collect all this data from around the country. And my idea is that let's, collect some information on what's happening in every district, right, on the economic side, in terms of food prices, shortages, etc. Those are things that we need to stay ahead of, right? But at the same time that we're collecting these data, it's actually possible for us to use these phone calls to also communicate with people, right? So you spread, because like the first week, people weren't taking the message seriously enough. And then the second week, it turned out to be exactly the opposite, right? Because of misinformation, there was this huge stigma that got created where, now, with the stigma of COVID, like nobody would touch them, medical professionals wouldn't go near them, etc., right? And that is even more dangerous in some ways because then people start hiding their symptoms, right? And then it becomes a much more difficult problem to solve, right? So then we were starting to put up, send out the accurate messages. And then we started doing a lot of A/B testing with this, right? Which is like, what's the density of people who you need to seed messages to in a given locality, right? Should you be adding some incentives? Because what we're doing is calling up people and saying, here's what we know, right? And we'd like you to pass on this message to your friends, right? and we'll send you some phone credit in order to do so. Okay? And in the past, in research I had done in Malawi and Nepal, this type of activity was very, this type of communication was very useful, like what we call social learning in the social science literature, right? Was much better than like sending out agricultural extension workers in order to get people to adopt new agricultural techniques, right? If it's working for agriculture, our idea was let's try it here as well, right? So that's one. And the second one that's really important is, Shitij mentioned completely unnecessary gatherings, right? Even though it's Ramadan, it's the last day of Ramadan, tomorrow's Eid, I'm going to say that getting large congregations of people together to pray together at a mosque is such an unnecessary gathering, right? And those can be like super spreader events, like we saw in South Korea at a church, right? And the thing is that the government sent a central directive. This happened in Indonesia, Nigeria, Pakistan, right? That you can't go on mosque, but that doesn't matter, because if the local masjid imams around the country are not paying attention to that, you're not going to get proper implementation. As Neelkanth pointed out, ultimately, implementation, enforcement is key, right? And that all happens at the local level, right? So we started building a database of masjid imams from around the country and started calling them. So first we developed a script, which was sort of in partnership with Islamic scholars as well as the Imam Training Academy in Dhaka, right? To say, okay, look, this is what the Quran and the Hadith says about during times of crisis, that you can stay home, you don't need to go to the mosque. Here's what Saudi Arabia is doing. Even Mecca and Medina, the important mosques have been closed, right? And if we can get them to endorse the message, then that would be, I think that would be really promising way to do it. And we're also collecting data. And the reason we're collecting data is that implementing this last bit of talking to imams was actually the most difficult thing for me to get past the government, right? And the reason is, talking to, I guess, communication with imams around the country, it's a politically sensitive issue. You can imagine in Pakistan, it's even more sensitive an issue, right? And people worry about like where the messages are coming from and how it's being relayed, right? Who they think is calling them, right? And so we decided to do this as therefore we said, okay, at least give us the permission to do it in like 50 districts, right? Or 50 unions. We'll do it. And then we'll have control unions. Let's see how it works. And if it doesn't work, you don't have to hear from me again. So I think it's also important for us to sort of constantly test, build evidence as we are trying out strategies, right? Because that's the only way that we can sort of make quick, as long as we can build the evidence base quickly, that we can change minds, right? And hopefully other countries can learn from as well.
I want to turn to a question that I think is a very important one. It's from Sunita Krishnan. And it says, as you can see on your screen, that the pragmatic acceptance of loss could be just a complacency factor and something that, those of us who cannot lock down will, in the end, be the most vulnerable, and they will be the most deprived. And also the load of non-communicable diseases, which is pretty high in India, which also affects younger individuals. So out of our discussion, what are the cautions that have to go with that so that we don't end up in the kind of situation that she's envisaging, where the messages from this group get taken on to say, well, so many of us will die and we'll just have to live with that. There is a equity issue here as well. Any of you want to take that up?
Look, I don't know if I can answer that, but I can.
Shitij and then Peter. Yes, please.
I said I don't know if I can answer it, but I would very much like to reinforce the caution that I think Sunita's question is highlighting. Anything that in the sort of academic circle is called pragmatic acceptance will have to be very carefully nuanced and titrated. And I think the pros and cons of that have to be very carefully thought through. And absolutely, with any such, I would say, concession, if that's the right word, it has to be wrapped up in a sort of socio-economic buffer to support. Because the only reason to do that is to get some gains on other fronts. And if those gains went to another segment of society, I think that would be grossly unfair. How to make sure that that balance actually works in favor of the people who are sacrificing is a very complex question. And I think if one cannot do that, then one might as well not do it, because you land up, hurting the unfortunate even more. And therefore, it's one thing to suggest it or even contemplate it in an academic thing. It's a wholly other thing. And I would just put my hands up and say, I have no idea whether that has any practical relevance.
Peter?
I think it's a great question. And I think the equity issues probably haven't been explored as much as they should be so far in the whole debate, which is focusing on the big picture and counting numbers and so forth. But I think it is widely recognised on the other side of the equation also that the costs on the economy of the lockdown are borne by the socially disadvantaged as well. And so that's very important to take. So getting back to work as quickly as possible is going to get as many very poor people in society back into incomes where they can sustain living much more quickly. So it cuts both ways, unfortunately. And I do sympathise with the question, and I agree with everything Shitij just said. There's no sense that we want to move to a situation with complacency, but trying to come up with this, I just think it's a good question, and I think we don't need to look at the inequality of the policy solutions, but they do apply on both sides of the equation.
And here, if I could turn to Neelkanth and just ask the question, should we be doing more on direct cash transfers, on social protection that's not just pushing liquidity and credit, but actual cash in hand?
See, one of the things that we must acknowledge is that everyone is interconnected. So this assumption that a lot of the commentary that about changes in labor law, etc., suggests that somehow the workers need the jobs more than the employers need the workers is, I think, see, there is a need that businesses have to employ, right? I mean, I am aware of many businesses which are worried that the migrant workers are not going to come back because they're so afraid of the big cities and the big infections, that till we are able to completely eradicate the infection, there was one estimate I just heard an hour and a half back now, that a third of the migrants may not come back. I don't agree with that assessment, but that fear is a real one. And therefore, when we are thinking about economic sort of costs, we should look beyond the immediate costs, because the creation of jobs is also going to come. So everything is interconnected. If you give, say, 2,000 rupees into every Jan Dhan account, it drives incomes, and which actually supports the businesses for a lot of the small and medium enterprises. So it could actually act as an equivalent of giving them subsidized credit. At the same time, if you say that my job is not to save the private sector and I will only take care of the poor, very soon you will have no taxes to take care of the poor, and the poor will have no jobs. So I think whatever economic approach we take to manage this lockdown and the aftermath, we have to acknowledge that having businesses run, and so therefore I think the decision to provide, because see, you can't unbankrupt a company. If a company goes bust, a company is a myth, right? And it is, there's nothing like Credit Suisse, right? Credit Suisse is a myth. All of us believe we work for it, and therefore we are a firm. Now, the day a firm shuts down, you are losing a lot of people, a lot of organization, a lot of hierarchy, relationships with customers and suppliers. So I think preservation of firms is as important if you're thinking about jobs and incomes and sustenance 1 year down the line, when by then hopefully the virus will be much better in control.
Mushfiq, did you want to come in on this? We have just a superb set of questions, but we're probably going to run out of time.
Yeah.
We have about 5 minutes more. Maybe we may indulge ourselves and request the attendees, of which we were more than 100 just a little while back. But please, Mushfiq, and then let's see what we can do with maybe a few more minutes. We can go on.
Sure. I've been trying to answer type out some of the answers in the Q&A box of others. So let me just pick up on two themes that have come up, especially in Neelkanth's comments. So one is that he talked about migrants, right? And I want to say a little bit about like how migrant families are experiencing this crisis differently from others, and what types of special accommodations we need to make to them for them. And the second comment is about like the benefit transfers, Jandan accounts, etc. Okay. So on the migrant issue, right? I'll just highlight there are two important reasons why migrants are experiencing things very differently. So one is that as we already discussed, the economic shocks are much larger for them, right? So even if coronavirus had never touched India at all, even if like India was in Australia's place and could have controlled the virus, even then there would have been an economic shock, especially for remittance-dependent households, right? Because you are exposed to the global crisis, right? If the coronavirus is in the Middle East, if it's in East Asia where many Indians work, or in Europe, then you're gonna feel it, right? And so something we've learned, so we, for those who care about empirical identification, etc. So one of the samples that we had was in Bangladesh. There was a lottery in 2013 for visas to Malaysia, right? So we had lottery winners and losers, and we had been tracking them for a while. And it turns out that lottery winners, people who got to migrate, those families, year after year after year, they earn a lot more, between 18% and 100% more than lottery losers, right? April 2020, like as soon as this crisis hit, we talked to them again, and it's totally reversed. These lottery winners, migrant families, are earning 36% less, right? So now, and why is that happening? In Nepal, we see people are coming back. They're forced back from the migration destinations, and even the ones remaining behind, they're sending a lot less money back. Okay? And so now, you need to address this, because these are people who are suffering even more, right? And the second problem we have is that, okay, if they're coming back, you need to, somehow get them involved in the local labor markets. But here, we know that migrants are the ones carrying the disease back, right? So in our other surveys in Bangladesh, what you find is we ask about, in the absence of testing, we ask about a series of COVID symptoms. So we work with the Yale Institute of Global Health and have an algorithm for trying to infer which community likely has COVID, okay? And what you find is that if you're in a community where there was a recent returnee, a migrant returnee, either internal or international migrant returnee, then you're 3 times as likely to report COVID symptoms, right? As opposed to in communities where you don't have it. So now we see this in the data, everybody also understands this. And that means that there's now a big stigma around migrant families, right? So it's not gonna be easy for them to come back to India, to Bangladesh, to Nepal, and suddenly find work, because nobody wants to hire them. Right? And so that requires, that's a case where we need special attention, right? And what could that special attention be? So let me connect it to the conversation about Jandan and social benefit transfers. Okay, so you have this existing system in India of targeting the poor, right, through PDS, etc. Like people, we know something about who the poor are, but now when you have this new type of crisis, there's a new category of poor who may not fall under the existing social benefit transfer system, and we need to update that system. Think about how do we identify these new poor, right? And that's not an easy task, and we need to do it very quickly, and it's not an easy task to do, but you need to bring together all types of available data. So what we're doing in Nigeria and Bangladesh is taking advantage of satellite maps, right, of where the poor areas are. In Bangladesh, as I said, we are taking advantage of cell phone usage patterns, right? Because it won't surprise us to learn that the poor people have subtle differences in their cell phone usage than you or I do, right? And so we need to, sort of use these big data to train models in order to try and identify the poor and get relief to them very, very quickly. Okay? And that's a complicated task, and it requires a multidisciplinary approach.
Thank you, Mushfiq. Again, the challenges are great, but we certainly have the data and certainly the talent to collect the data and to be able to use it, and that, I think, is a very clear conclusion that emerges from this. We are at the end of our scheduled time. Maybe if I could just request each of you to come and close out with what you would recommend should be the Indian roadmap for managing, and remember we chose all these words carefully, it is managing the pandemic, not eliminating the pandemic. And it is really an Indian roadmap that we need. But I do believe that if we are able to make progress, that's going to be a lodestar for many other countries which are not as well resourced even as us and even as those of us in India are. So I think that's a major contribution that could also ensue. So let me start with Peter and then just go around. Peter? You need to unmute yourself, please.
Yes. I'll just make one observation, which was going back to the conversations before about communications. And I know it's something you wanted to touch on, Shekhar, which is the federalism and so forth. I think if you compare New Zealand and Australia, I think New Zealand's done a much more effective job at getting messaging out, and it's been much more consistent. And part of that is related to the lack of federalism in New Zealand. In Australia, we've had mixed messages, with premiers giving different messages about going back to school for school kids and so forth, all claiming, all saying that it's on the expert advice. So Jacinda Ardern is a very good communicator, and she sort of came up very quickly with a stage sort of stage 1, stage 2, stage 3, so forth. And she uses useful language too, like just saying to people, behave as if you were infected. And that simple language which gets people in the right mindset. So you're not scared, but you're actually taking caution. So I think there are simple things, and there's been really good suggestions on the panel as well for how you might be able to manage the crisis more effectively at very low cost.
Shitij?
Well, I can't suggest what the roadmap should say, but I can suggest that there is probably room for you to have one, as in other words, outside of the government, for the tremendous amount of brilliance that lies in India's universities, its private sector. You know, there has to be a way to bring that together with not just one, but likely two viable plans, because what I point out is we gave the government two options, and frankly, it was neither of them. It was 1.5 somewhere in between them. So I'm surprised that I have not as yet seen a sort of cohesive plan coming in India outside the government. Now, I'm sure there's multiple plans within government. So I'm hoping perhaps Shekhar, you or your colleagues or the tremendous talent that lies in other non-governmental organizations could come up with a plan. Not that the government follows it, but it starts providing some guardrails and guidelines which inform the discussion. So I would just wish you that and urge you to lead in that.
Thank you, Mushfiq?
Yeah, you know, I'll just use my 1 minute to bring up one aspect of the issue that we gave short shrift today. So we talked about really important problems. Now, of course, there are many dimensions by which this problem can be realized in different parts of society. So we didn't do a great job talking about gender aspects of this problem, for example, right? So there are, you know, so just like I'm talking about migrants, you know, there are, you know, female migrants who've been working, and I hope there are many people in the audience. Like, just because we didn't cover it, like we shouldn't give it short shrift, or we shouldn't ignore the problem. So similarly, we should be thinking carefully about if we are sending social benefit transfers, right? Are the systems that we're setting up adequately covering minorities, whether it's migrants or women or low caste or religious minorities, etc. So sorry, we don't have time to talk about it, unfortunately. Maybe in the future we'll have a panel on this, but let's not forget these dimensions of the problem as well.
Yeah, Mushfiq, I think I'm grateful to you for actually bringing those up. We just didn't have enough time, but clearly those are important concerns, and I know that in the road to recovery you have indeed dealt very carefully with these precise sets of issues. Let's close out with Neelkanth.
Yeah, so I think the messaging and the communication now perhaps will explicitly now change to the fact that we now need to learn to live with the virus, and the fact that we are now starting trains and restarting flights with precautions, and then relatively open debate on what quarantining requirements are required. So if someone has to make a day trip to say from Delhi to Kerala, that may not be possible if you need 14 days of quarantine there and then 14 days on the way back. How do you open up? And I think so that making that debate explicit and acknowledging that now we are in a very different stage of handling the virus. And also communicating that, things like wearing a mask. I mean, the mask is not to protect yourself. The mask is to protect others. The kind of mask that people wear, your droplets going out in the air and infecting others, that it is you're being responsible to others. Those kind of subtle messaging changes, that we are in this together. And I think those changes, I suppose it's a matter of time before they will start coming through. But I think it's equally important that the economic management, come back to the points I had raised, where we look at equitably between firms and their workers, as well as the near-term economic loss versus the medium-term economic loss, acknowledging that we are in this for a while, and therefore changing policies to move.
Thank you, Neelkant. With that, I want to thank this really distinguished, thoughtful, and very insightful panel, Shitij, Peter, Mushfiq, and Neelkant. I think this has been one of the best discussions we've had. I take it from what I've heard that even though, as Neelkant pointed out, we are actually moving in that direction, that kind of direction that we've been talking about. And I take it from everything that I've heard that even now it would be useful for a group like what you had, Shitij and Peter, that we do come together and think about putting out maybe even now a couple of options that are carefully thought through. And again, they may never be adopted wholesale, but they will inform and they will actually allow people to use them as benchmarks and for things that we do. With that, let me thank all our participants. I'm sorry we've run over 10 minutes, but I think this was just such a rich discussion that I didn't have the heart to cut it off. Thank you all for being with us. Thank you to all my panelists. I do hope that we can actually pull this group together again and perhaps take stock in a few weeks' time to see where we are. And I'm sure that there's going to be a lot to discuss then. Again, I want to thank particularly my Australian friends, Shitij in particular. It's past 11 for him at night. Thank you for staying up. Perth is a little better. And Mushfiq, thanks for waking up early in the morning. Again, this has been great, and I look forward to remaining in touch with all of you, and hopefully we can do some work together. Thank you all, and good night.
Thank
Thank you.